Welcome back, BSides Delaware. My name is Rando, your MC for this afternoon. We are back from lunch, and I hope you got your lunching and food comas settling in nicely. We return with Mr. Rob Slade on security lessons from COVID-19. Take it away, Rob.
Thank you very much. It's not just after lunch for me. I haven't even had my breakfast yet. I'm out here on the wet coast of Canada, so I'm an untrustworthy alien from your perspective. Anyways, and bearing that in mind, there's the QR code that you can get all the information about me quite safely, bearing in mind that I got my start in security doing malware research, so I know every way to trick people to installing bad things on their computers. Now, it's listed in the slides as BCP and privacy lessons from COVID-19. You'll see the title here is Security Lessons from COVID-19. This is normally actually the third of three parts of security lessons from COVID-19. But it's a bit of a catch-all, but yes, we are going to be talking about business continuity planning, privacy, a little bit about application security, and we'll see what else has dropped into the slide deck while I wasn't looking. Okay, just to refresh your memory, everybody else said the pandemic started March 11th, 2020, because that was the first day the World Health Organization was willing to use the word pandemic, and there was the infamous basketball game that ended sports as we know it, although we seem to have started that up again. It's important to do the important things in life, yes. But for me, it all started on March the 10th, and that particular morning here in Vancouver, March is a big month for security. We have CanSec West, we have normally BSides, sometimes we have BC Aware, and the Vancouver Security Special Interest Group always has their monthly meetings. So I was slated to go to two conferences. I had two speaking engagement, three conferences actually. Yes, I remember talking about it at coffee that morning with somebody, and by dinner time, bang, it was all gone. So life can change rather drastically in a very short space of time, and it's important to bear that in mind when you're thinking about business continuity planning and how it's going to work. It's not everything, not every event affects everybody equally, and this is actually an old illustration, but it was sort of case numbers for basically pretty much everywhere. Over 5 million population at the time, and the numbers involved there. And I'm in a bit of a privileged position because that little blue dot right at the bottom, that's British Columbia. So anyways, I will make a suggestion, particularly for those of you who are interested in security awareness training, or really any kind of communication of a complex and difficult subject. I really recommend the Dr. Bonnie Show, which is not called the Dr. Bonnie Show on this YouTube channel. This particular YouTube channel is the BC government YouTube channel, so you may have to set up a VPN and say you're from Canada in order to get at it. But it's if you will look up the COVID-19 updates on that channel, we have a secret weapon here in BC, and that is Dr. Bonnie Henry. And she has provided an absolute masterclass in effective communication of difficult topics and situations. So just throw that in there as a benefit to you, those of you who are dealing with communications or education in any way. It's really, really exemplar material there. And seeing as how we're talking about privacy partly, by the way, you're being recorded, as I understand here, so that will be something to consider as you participate or not. Again, in terms of privacy here, some really interesting things that we have. Contact tracing is something that is important in terms of public health in a pandemic or any kind of epidemic, really. But of course, there's always the privacy concerns and the confidentiality concerns there. The issues of vaccine administration and vaccine passports. Really interesting that the term vaccine passport has changed from the beginning of the pandemic, when people were actually talking about passports being able to get into another country. But now, when we say vaccine passports, what we're talking about is generally the little either slips of paper or QR codes that your local health authority, whether it's state or regional, whatever it may be, gives you to say that you have in fact been vaccinated, so that you can get into restaurants and gyms and stuff like that. So it's interesting that the differences in the importance and the privacy protections that go into it, whether you're talking about something just to get you into a restaurant or something to get you into another country, and so interesting variations in the discussion of what is a vaccine passport, what does it need, and how it needs to be protected. So lots and lots of that. Here you may have noticed we're going through the CIA triad: confidentiality, now integrity. Mis and disinformation has been huge in the pandemic. During the pandemic, there have been all kinds of problems with misinformation. On the one hand, people taking ivermectin and things like that, poisoning themselves in many cases. There have been many more cases of ivermectin poisoning than people who will say that they have been protected by the stuff. And there's been a significant drop in the use of news media sources during the pandemic. People have instead been turning to friends, neighbors, and just random strangers on the internet to pick up their information, and very often it's wrong. Again, as I say, there's a significant increase in the use of social media as news sources during the pandemic, and all kinds of really interesting factors here. QAnon, of course, not as big an issue as he was back in Trump period, but the QAnon, whatever source originates this garbage, produces what are referred to as breadcrumbs, and these are sort of hints that people then have to follow. It's sort of like a paper chase to go and find the information, and so doing it in that way makes people think that they have actually done research, even though they're just following a trail of breadcrumbs that somebody's laid down for them, and it makes people much more resistant to correction in terms of the misinformation and disinformation that's out there. So some really interesting stuff that's happening, and I'm sure in the years and even decades to come, people are going to be going back to this period of the pandemic in terms of research into mis and disinformation and how to deal with it. Availability, and here, of course, we get closer to our BCP stuff. Toilet paper, really? I mean, honest to goodness, I defer to nobody in my admiration for toilet paper. I think it's, the two greatest inventions of the 20th century were toilet paper and the internet. But really, there is nothing magical about it. And the fact that, you could not buy toilet paper for months, it's just so bizarre that people were rushing out and buying toilet paper. The pandemic certainly was an issue in terms of supply chains, and certainly there's been an issues in shortage of various things, but toilet paper is it's got no medical properties. it's really kind of weird that was what everybody went out and bought. But of course, the supply chains we've seen the problems with that stuff, the issues around the supply chains. We're seeing that everywhere in terms of production, chip shortages, raw material shortages. Christmas coming up and retail stock not being available. The lack of choice in all areas of retail availabilities and that sort of thing. But in addition, we've seen other problems with the supply chains, such as, for example, at solar winds, people relying on solar winds as a means of managing their IT infrastructure, and yet at the same time, that makes it a single point of failure, and somebody managed to get in there, drop something into that supply chain, as it were, and got into the systems of all kinds of people all over the world. We have to think of supply chains not just in terms of, can I get this particular product? Is this going to be available to me? But in addition, is this particular point in the supply chain secure in and of itself? Is it going to affect me in some negative way by it being compromised itself? And that's, solar winds, of course, we're dealing with IT infrastructure all the time. But there's issues in terms of physical supply as well. Going back to pandemic issues, the supplies of medical equipment and personal protective equipment. And all of a sudden, people were seeing shipments of gloves, masks, scans, whatever it may be, that did not meet the standards that they were supposed to cover. Lots and lots of issues to look at in those areas. It's, and again, as I say, the issues of supply chains lead us nicely into business continuity. But a few things to address in other areas of security. Risk management, of course, is big area in security. And of course, always the cost benefit analysis. Really interesting to look at the issues of, isolation, quarantine, lockdown mandates of various types versus reopening the economy. And of course, when we are talking about issues, security serves business. It's, we're not doing this by ourselves. We are there to support the business. But at the same time, life safety is the number one priority. So how do we balance those in terms of that kind of cost-benefit analysis? And emergency management. So many issues around this. We've had disasters, a number of disasters during the pandemic. Which is problems piled on top of problems, and it's tragic and that sort of thing. But then you get these people, going on TV and saying, well, they put us up in a hotel, but it's not a very good hotel. Well, for crying out loud, emergency management is for emergencies. This is not a time to complain that things are not perfect, because this is a vast imperfection, and it's always more important to have the actual, even if it is not perfect, than to strive for perfection and not deliver anything at all. So a number of things. Again, in terms of emergency management. And again, this is something that you would unfortunately have to go to, set up a VPN until you're from Canada. But if you can get it attached to knowledge.ca, do a search for a program, 5-part documentary there called Search and Rescue North Shore. It's shot in my backyard, so absolutely gorgeous scenery around all of it, but an amazing piece of filmmaking as well. They, have cameras mounted on people's helmets, cameras on helicopters, cameras on teams on the ground, people going in with the teams. But in addition, they put cameras on ropes that were hanging gear and flying into areas. So, and the editing to put it all together is quite astounding. But anyways, an impressive piece of material there. Again, one of the things that the pandemic has pointed out is that people do not understand risk overall, and the fact that it's not a binary issue. There's always statistics involved and probability, but particularly the concept of defense in depth and layered defense that we in security know and use and have to rely on all the time. Staying home isn't perfect. Distancing isn't perfect. Hand washing isn't perfect. Masks aren't perfect. Vaccines aren't perfect. I'm sorry, it just doesn't happen. But, we have to look at it in terms of layered defense and defense in depth. In terms of physical distance, this was rather amusing. This is an asphalt grinder. That was near my house while I was preparing this stuff, and here's a sticker on it that says, that you have to maintain 2 meters of social distance. And I just kind of wondered, I know that it's for the workers in operating around the machine, and just general instructions to everybody in the workplace. Now we have to do physical distance, but for crying out loud, who is going to need a warning to stay 2 meters away from an asphalt grinder? Anyways, just amusing. And again, in terms of masks, this mask won't protect you from COVID-19, but it'll sure help with the social distancing. So lots of issues there. And again, in terms of physical distancing, social distancing during the virus crisis, if you must go out, note that you might get coughed on or sneezed on, and since disinfecting fabric is much more difficult than cleaning flat surfaces, you should wear older clothing that can be discarded if necessary. If you have old, torn clothing that will not be missed, this is probably best. Since face masks are in short supply, a scarf worn over the nose, mouth, and lower part of the face may offer some protection. If you are infected and must go out for some reason, take a staff to aid you in walking should you be overcome with respiratory distress and need something to lean on. Best to have bells hanging from the top to summon aid if needed. As you go, it is best to give some verbal warning to others not to come into close contact. Since you may encounter some people who may not be proficient in English, it's probably best to constantly call out something simple such as unclean, unclean. And this is not meant to make fun of anybody who actually has Hansen's disease. But anyways. Another issue in there is cars and insurance. So many comments that I've heard from people, saying, during the lockdown we couldn't drive anywhere. Why don't we get a rebate on our insurance? Look, I've seen the way you guys have been driving since you got out of lockdown. I know why the insurance companies are not giving you a rebate. This was interesting that again, as during the lockdown people can't congregate and that sort of thing, but I found that the smokers were really interesting. There's no smoking rules indoors and how far away you have to be from doors and that sort of thing. But why did they always choose to be beside the natural gas meters at the mall? I really kind of wondered about that then. So all kinds of things that came out during the pandemic, all kinds of ideas, and one of the things was ultraviolet, and ultraviolet light does kill viruses, yes, but unfortunately, like with spraying bleach around places, the intensity of the UV that you have to kill the viruses is actually, possibly enough to harm you. Certainly when they're doing it, in this 15-second stuff to disinfect. And there were wands, there were things that you pushed your shopping carts through. There were robots that would go through airplanes and what have you. And just, the intensity of ultraviolet that you need to kill bacteria, viruses, and that sort of thing, is really very intense, and it's dangerous. I know because I worked in a hospital, and we had UV devices for debriding infected wounds. We were not allowed to use it. Only the specialists were allowed to use it, because if you didn't use it properly, if you weren't careful it was enough to strip the skin off your arms. So, lots and lots of these UV lamps that have been sold are, really, if they're weak enough to be safe, they're not strong enough to do you any good in terms of killing viruses. So it's very interesting. One of the things that suddenly struck me, as we're getting nervous about, actually meeting people, and then I was, looking. We watch a lot of old movies and that sort of thing, and so parties and that sort of thing that go on in the movies are. The older movies are just, oh no, can't, that's dangerous. You're too close together. And it was really kind of funny when I was thinking about this in the mall. I'm walking down the middle of the mall and going around corners wide so that I'm not going to actually bump into anybody by accident. And so these, movies where somebody suddenly jumps out of a dark corner, it's sort of like, what are you doing walking that close to a dark corner? But the other ones, the gangster movies where they're, a whole bunch of armed guys, with paranoia ratcheted up to 11, are all meeting in a huge warehouse, and that, spread out. You sort of look at that and, hey, you guys have got it, so whatever. Yeah, probably. Don't need a break, but the German government is advising people to stock up on sausage and cheese. It may be a worst case scenario. So, business continuity planning. Now, in business continuity planning, we are always after management, senior management, to actually do it, to build the budget, to address these issues. And as this guy from Dow Chemical has said, the best way to get management excited about a disaster plan is to burn down the building across the street. Well, for crying out loud, for the past couple of years, an awful lot of buildings have been burning down across an awful lot of streets, figuratively speaking anyway. So use this as a reason for business continuity planning. Use the fact that all these changes have happened to provide a reason to management to address this issue, to help out, to to make sure that you are addressing the dangers properly. It's it is not too much of a stretch to be able to say, we're in the midst of a disaster. We have to continue to think about disasters, because if we get hit by another one some other way, this is not the time to have an unintended impact on our business. It may seem like this is not the time to do any extra work, but really, this is the primary time to do the extra work, to prepare. The pandemic doesn't mean that everybody else has, every other disaster has finished. I mean, California burned down, my province burned down. there have been hurricanes, there have been floods, there have been disasters. The disasters will not wait. And in fact, because of the pressures from the pandemic, it is more important to do business continuity planning here rather than less. A number of lessons that the pandemic has taught us, which really we should have been addressing already, but a lot of the stuff in terms of risk management, a lot of our literature in security does come from the financial industry, and it's really interesting when you go into it in depth and look at it. You will find that what financial industry is talking about when they talk about risk is capital risk, financial margin. Do you have enough money to weather some change in the commercial environment? Do you have enough in reserve to weather a financial storm that may come along? Everything that we think about, or we tend to think about mostly, in terms of our risk management and risk assessment, they tend to lump in one small corner, which they call operational risk. So they're concentrating on the capital risk, and we unfortunately have not. And we probably should be looking at that more. And certainly a number of companies have experienced during the pandemic that there have been sudden changes in the market and massive changes. Now, some people, this was great. They, made out like bandits. They, Amazon, for example, everybody's ordering everything online, so Amazon is, doing great guns, except for the fact that Amazon can't find enough employees to actually work for them. So, that's another change in the market. The labor market has changed, and all kinds of industry sectors have found that themselves. Restaurants during reopening situations, there's a lot of demand for the restaurants, but they can't find the people. So, different kinds of market changes. And that issue of not being able to find employees also sort of leads to succession planning. And we've seen this. We've had a pandemic. A lot of people have died or got sick. Some people will get COVID and they don't actually die, but about 30% of people who get COVID get long COVID. And so if you've got your senior management people now with long COVID and, afflicted by fatigue and brain fog and that sort of thing, they still can't do what you need them to do. Certainly somebody who's got brain fog is not somebody that you want making the major decisions about policy and ongoing long-term stuff. So having succession planning is very important. It always has been important in all kinds of disasters. But the pandemic has pointed out a number of areas that need to be addressed in succession planning there. And again, the issue of supply chains, we've talked about that briefly, but certainly major issue and a number of things there, including the issue of hoarding. And hoarding is sort of one of the dirty little secrets of capitalist society, that everybody is individually responsible for their own provisions, and so you get a lot of people. That's why you couldn't get toilet paper, was everybody was hoarding toilet paper. That is a problem that is created by everybody trying to do the best thing for themselves. And so you need to plan issues addressing some of these social factors into your business continuity planning. Other things about business continuity planning: full-scale business continuity plan for a large company really takes about 3 years, and so you need to do it beforehand. You need to do it in advance. The P, it's BCP and DRP. Both of the P's there, planning. IRP, incident response planning. Planning. It has to be planned in advance. So you've got to start early to do this. The middle of the disaster is not the time to try and do business continuity planning. Not for this disaster. You've got to do it for something else. And again, the issue of the best is the enemy of the good. It's we aren't looking for perfection necessarily. We always want it to be as good as.
Apologize, BSides Delaware. I think we're having some voice technical issues. Let's see if Rob is still there. Hey, Rob, I don't have any audio from you right now. Hopefully he can hear me. I would continue Rob's talk for him, but he's much smarter than I am. So let's see if we can bring Rob back. Hey, Rob, if you can still hear me and you want to stop presenting, and then start presenting again, maybe we can fix this real quick. Nope, nothing. Rob. All right, we're going to hit to an intermission just a little bit early. I think we lost Rob, and maybe we can get him back a little bit later. Apologize for the technical glitch. BSides, we will be right back.
Are we?
Oh, hey.
Are we online?
Hey, Rob, there you are. You back?
Yes, I'm back. Okay. So let's.
All right. Sorry, we lost you for about 2 minutes there.
Okay. Let me see here. Just making sure that we've got everything.
Yep, I got your slides. I got your voice. You're ready to go.
Okay. So let's back here. Let's just make sure that yeah. Anyways, any job worth doing is worth doing badly. Here, I've just demonstrated that very effectively. But yeah, this is emergency management. This is trying to do the best in a bad situation. So again, the actual is better than the perfect. In business continuity planning, leadership is very, very important, and the leadership we have seen a number of issues of leadership during the pandemic, and how that works. And one of the things that has been important that in a number of those examples is consistency. You've got to be consistent in your basic principles. Now, very interesting, of course, again, in a pandemic, and particularly in a pandemic, this is a virus of a class that we didn't even know up until the 1960s. Coronaviruses were discovered, and it was rather interesting in terms of the name there. I had thought that it was the spike proteins, that little crowns all around the surface, but actually when they were first discovered, electron microscopes did not have enough resolution to give that level of detail, and so all people could see was this kind of hazy outline, a corona around the virus, and so that's where the name came from, coronavirus, which is interesting in terms of Canadian content time because the electron microscope is Canadian invention. But anyway, the facts have changed. We're finding more and more data on issues. A number of things have come out in the course of the past 2 years in discovering about coronaviruses in general and this particular family of viruses and the mutations that have come along. But the consistency of background principles has been vitally important, and people who have not had those background principles driving what they do, their leadership has not been very effective during this whole crisis, and so that is an area to be addressed. Again, looking at the Dr. Bonnie show, the consistency that Bonnie Henry has shown over the course of the pandemic is impressive, and she's saved a lot of lives, kept a lot of people safe. I'm a really big fan. In terms of business continuity, this is something that we have seen. In terms of technical stuff, when you recover, you can go into recovery when a disaster has happened. You recover the most important items first, and this has been an example, or the pandemic has sort of been a special case of this. You can do lockdown, you can stop fast, and you want to do this early. And we've seen this over and over again, that places that did not go into lockdown early have taken much, much longer to get their recovery going. But when you go into restoration, when you've had the disaster happening and you are starting to get back into your original location, you restore the most important stuff last. And so the restarts of the economy in the pandemic have been slow. So, stop fast, restart slow is sort of important principles in business continuity planning. This was interesting, what I've seen in the pandemic, the issue of efficiency, and I mean, we all live in a capitalist society. Just about everywhere is running on it. Any other types of economic systems have really had massive problems, but capitalism has worshipped at the altar of efficiency and reducing margins, and for about 40 years I've really been looking at this and this efficiency at all costs, and wondering why it is, and that I've been uneasy about it. And the pandemic and finally showed it up in large scale here. Efficient systems are brittle. When we reduce the margins, when we really go all out for efficiency, we set ourselves up for problems. We don't have that margin. We don't have that slack. And so again, in terms of building resilience into your enterprise at all levels, which again is part of business continuity planning, look at that issue of efficiency. Yes, you want to do things, you want to avoid flat out waste if you possibly can, but consider, when you cut things to the bone, there's no further to cut when something bad happens. So again, efficiency is not the be all and end all. Again, have some redundancy to build resilience into your enterprise. Yes, cut down the margins, but not too far. Now, again, planning. Like I said, the P stands for planning. Planning has to be done ahead of time. Do it in advance. It was really interesting here in Canada. We had, we've even had a federal election over the course of this. Not too bad, but a lot of people, every time an election was called, were just, freaking out. How are we going to conduct an election during a pandemic? And we had an election here in BC, and it was done fairly well. And in terms of risk management here, I am old, I am male, I am fat, I have high blood pressure and diabetes. If any stray SARS-CoV-2 lands on me, I'm toast. So, I've got to take extra precautions here. And so I planned ahead. When they called the election, I signed up for, mail-in ballots. I found out where the office was, went and actually, I didn't even mail it. I dropped my ballots in at the elections office, so that I didn't have to, line up on election day and that sort of thing. So, that's planning. Newfoundland had, other side of the country, they also had an election during the pandemic, and they did not plan as well for the pandemic response. And as they started into the election, they got hit by a sudden wave, and so their election was a bit of a mess. There's also issues again. Long-term care homes and facilities have been hit particularly hard. They've been hotspots during the pandemic, and of course, a lot of people have died in those care homes, and that is always accompanied by weeping children, elderly children, saying, "Oh, if only I'd known, I wouldn't have put mom in a home and she died there." Well, this is not something that was terribly hard to figure out. If you are now, so terribly broken up about putting mom in a home, you left her in there. If you were really concerned about that, you should have, thought about it and made some other provisions for those types of situations. Okay. What is happening here that we can't? Oh dear. Okay. Let's get the slideshow back up and running. Guys, there we go. Sorry about this. It's business continuity. Okay, Anyways, we're restarting here. We will be back with you shortly and get the slides back up. And there we go, and back to sharing our window. Skip through a few slides before we get to where we were. Where were we here? Okay, this is all revision. We can just say that. This is a review of the material. Okay. So, oh yes, good old raw toilet paper for sale, $20. Some assembly required there. As I mentioned, toilet paper support. Cryptography. I actually wrote a book, Cybersecurity Lessons from COVID-19 during the pandemic. It's an interesting exercise. I went through the domains of security, and I thought, okay, cryptography is not an area that the pandemic will, have an impact on or any lessons from. Wrong. So the contact tracing here is really interesting, that the DP3T protocol here just uses pure random numbers. So we're not providing any personally identifiable information. So there's no issues of privacy here. as long as it's really interesting, as long as we're only dealing with the random numbers, it's okay. But as soon as we start collecting and associating, say, location data or even time data with those random numbers, we start to get possibilities of losing private information and breaking confidentiality. So really, really interesting. Again, a little bit of a point of addressing cryptography. Not an awful lot, but some. Application security, testing, the different types of testing. Right now, there's issues of if you don't have if you aren't fully vaccinated, you've got to get a test. Or if you're traveling to certain locations, like coming to Canada, sorry, it's not my fault. The government decides these things. That you've got to have a PCR test. And people are saying, well, why don't you do the rapid testing? Well, the thing is, the rapid tests give different types of information. For example, the rapid tests very often will indicate whether you have ever had COVID. Not just whether you have it right now. So, if you've ever had COVID, you may, get a positive there. Also, the PCR tests are much, much more accurate. The rapid testing things, some of their accuracy levels, or rather their error rates, are around 30%. And that's just, when people are saying, we want the rapid tests because they're easier and quicker and that sort of thing. But they, what happens when you get a false positive? How do you like the rapid test now? Everything. And then, this is, again, a little bit amusing. During the pandemic, a paper plant that was, was infected with malware. And so I'm telling everybody who stockpiled toilet paper should safely dispose of it because it may have been infected by a virus. And then, of course, I have to explain that's a joke. It does, biological viruses and computer viruses do not have anything in common. And no, you can't catch, your computer can't catch a virus from COVID, and you can't get COVID from a virus on your computer. One of the things that I have known for a long time, like I said, I came from the virus, originally just viruses, but more generally malware research community. And when I got more formally into security, one of the things that I learned very quickly was the Bastion model was, everybody else's model in security, and the Bastion model is wrong. The Bastion model says that, we have, we build walls around ourselves. We're the good guys. We're on the inside. Everybody on the outside is bad. They're attacking us, and as long as we have that wall, we're okay. Under the Bastion model, if a hacker, an intruder of whatever kind is attacking you, that's not my problem. As a matter of fact, maybe that's good, because if the intruder is attacking you, he's not attacking me. But when you come from malware research, and particularly virus research, if you get infected with a virus, that's a problem for me, because all of a sudden, you are starting to spread the viruses and that sort of thing. So, the Bastion model, we all think, we're on the inside. We don't have to address anybody else. We don't have to help it. And knowing that helping others helps you is much more important for security. We are all in this together. As many people have said, we're not necessarily in the same boat, but we're all in the same storm. And that, again, is something to address in your business continuity planning, in security in general. Oh, I have, uh, I am rather famously don't like Slack, and I thought I hated Slack until I was forced to use Microsoft Teams. And then I thought I hated Teams until I was forced to use Discord. But we won't say anything about that. I found a bug in Microsoft Teams. The agenda view disappears after you scheduled meetings. And Gloria, my wife, says that this is proof that Teams was created by kids who never learned to plan and do everything on an ad hoc basis. And I don't have any evidence to indicate that she is incorrect. Ransomware and new virus strains. Now, first of all, I got to say about ransomware, everybody talks about ransomware, and half of them are wrong, because there are two things that are both being called ransomware incorrectly. Ransomware is about software that gets into your system, it encrypts your stuff, and then, it's of a ransom demand. But there's also breach extortion, which is when somebody gets in, takes your information, and then threatens you, and it says that you got to pay us a ransom, or we're going to release this to the world. That is not ransomware. That wasn't dealt with by malware, by software, and it's a different thing. Ransomware. We know how to fix ransomware. Make a backup. I mean, we've been telling people for years to make a backup. That's all you need to do. You make a backup. You don't have to worry about ransomware. Whirlpool has been hit by ransomware. And at the same time, we've seen during the pandemic new, more infectious, more transmissible strains of the coronavirus discovered in various places. Right now, I think Delta is the big one, but I know that they're keeping an eye on things called AY26 and AY27, and they're trying to figure out if they're going to be important. And in both cases, my response is, so what? We know how to fix this. If it's ransomware, we make a backup. You're fixed. In terms of new strains of the virus, yes, maybe it's more transmissible, but we know how to fix this. There's the 5 heroic acts of the World Health Organization. Stay apart from people, wash your hands, so on and so forth. The thing is, this is not a difference in kind. This is just, maybe this new strain is more transmissible. Maybe this new strain is more infectious. Maybe it's more deadly in terms of mortality. But it's not a game changer. It just means that you have to double down on what we were already doing. And the same thing is happening. We know how to fix this. Do not panic. Okay, law, investigation, and ethics. Again, this privacy gets into here a bit. And a lot of people have been freaking out over, mandates, lockdowns, that sort of thing, and quoting Benjamin Franklin, they that give up essential liberty to obtain a little temporary safety deserve neither liberty nor safety, Well, look, I mean, when people are dying, then that's, not an issue of liberty there. They say, my body, my choice. Yeah, do you want casket or urn? This is important. Contact tracing and privacy, we've talked about. Forensics, the evidence, the testing, the data that we're getting, all of that is important in forensics, and we're seeing the importance of relying on specific data, specific evidence, real data, rather than people's theories during the pandemic here. Really interesting, the privacy issues here. Doctor's appointments have been mostly by phone during the pandemic, which is really interesting. During a pandemic, we're dealing with issues of health, but here the doctors decided that they needed a consent form to deal with issues of privacy. And so you go to a website, you would sign this consent form, which you had to pay for. It was really interesting. Pay to sign a form, rather bizarre. But anyways, Interestingly, on this form, they had no means of correction. So, there we're violating one of the EU directives right off the top. And there was, there were several violations of accuracy and the right of correction principles in this form. So this form, which was meant to address issues of privacy, itself violated privacy protection principles. So interesting stuff. Again, in terms of privacy and the vaccine passports, early on when we were thinking that the passports were going to be actual passports, a lot of information was going to have to be carried on those things. Details of the vaccine, which version did you get, what date, multi-shot, did you need a booster, did you have a booster? Were we going to keep that information on the card, on a central database? What would happen with jurisdictions accessing health information from another jurisdiction? They may not have been too terribly friendly to. Details of the testing, of whether or not you had PCR tests or rapid tests or whatever. What type of testing? What was the date of the testing? So, tons and tons of information that we were considering at that point in terms of the vaccine passports. Now, of course, it's been somewhat restricted in terms of just have you had a vaccine? Had you had both vaccines? That sort of thing. Yeah, this is kind of personal, but I'm very disappointed in terms of the social responses to the pandemic. It has seemed to open the floodgates of bad behavior for a lot of people, and of course, racism has come full force. People have been making statements about Asians because the virus first seemingly showed up in China. The different ethnicities seem to have been affected differently by the virus. That is still something that needs to be researched because it's only vague indications that we've got. Certainly, any ethnic communities that we can tie to lower economic status have been hit very, very hard by the pandemic. They've been hit a lot harder than those of us who actually have jobs and money and those types of things. But the issue of racism has been a very disturbing one. You guys have had the Black Lives Matter, and this is a Canadian joke. A Canadian is DP with seniority. It's kind of multi-layered. I have to explain that DP means displaced person. It's basically another term for refugee, but it's also essentially a racist term because a DP is somebody that it was a pejorative term. That this was somebody who came from a different culture and very often from a different race. Racism shows up in all kinds of things. We have to fight it in many, many different ways. This is Dr. Bonnie, who I've talked about a number of times, and she's saved a lot of lives, and I'm running out of time, so that's all I'll say about that.